What do you think is the most embarrassing symptom of Sjogren syndrome? Bad breath? Bladder leaks? Brain fog? We've spent a lot of time in this community talking to people who've been diagnosed with Sjogren's. Some have struggled for years just to get a name for what they were feeling. Some are finally managing well. And some are still fighting to be believed. And we asked a few of them one simple question. What symptom do you wish you'd paid more attention to, or were too embarrassed to bring up sooner? And the answers were more consistent than we ever expected. So in this video, let's go through the full picture of what Sjogren's can actually do to the body, including the signs nobody talks about, and figure out how to recognize this condition before it causes serious damage. Now, Sjogren's affects an estimated 3 to 4 million people in the United States alone, making it about as common as rheumatoid arthritis. And yet most people have never heard of it. 9 out of 10 people diagnosed are women. And here's the part that should stop you cold. By the time most people finally get a diagnosis, an average of 9 to 11 years have already passed since their symptoms first started. Not months. Years. That is not a gap. That is a canyon. And a big part of why that gap exists is embarrassment. People aren't telling their doctors the whole story. So let's change that, right now, starting from the top of the body and working our way down. Hit subscribe and leave a like. That helps this channel reach more people who need it. The goal at Health Inside is 200,000 subscribers, and every single person who joins moves us closer. And if that sentence just landed for you, if something in what I've described so far sounds familiar, I've put together a symptom map that shows exactly how this condition progresses, what shows up at each stage, and where the standard tests are most likely to miss it. Type symptom map in the comments right now and I'll send you the link to access it directly. Number 1. Rapid tooth decay and tooth loss. You are brushing twice a day. You are flossing. You are doing everything right. And yet every time you sit in that dentist chair, there is another cavity. Another crack. Another tooth that needs to come out. Your dentist looks at you like you have been living on candy and soda, and you sit there feeling judged and confused because you know that is not the case. Here is what is actually happening. Saliva is not just water in your mouth. It is a sophisticated biological fluid packed with proteins, enzymes, and antimicrobial compounds whose entire job is to protect your teeth around the clock. It neutralizes the acids that bacteria produce. It remineralizes the enamel. It washes away food particles before they can cause damage. In Sjogren's, the immune system attacks the glands that produce it, and without that protection, aggressive cavities form rapidly along the gum line, spreading fast and leading to extractions even when the tooth looks fine from the outside. People in their 40s and 50s find themselves losing teeth that should last another 40 years. They get dentures. They spend thousands on implants. They stop smiling in photographs. And the tragedy is they blame themselves. Bad genes, poor hygiene, not catching it in time. Nobody has ever told them that an autoimmune disease has been quietly stripping away the very system designed to protect their teeth. Beyond cavities, Sjogren's creates the perfect environment for oral infections like thrush, accelerated gum disease, and a burning sensation in the mouth and tongue, sometimes described as feeling like a scalded mouth from hot coffee, except nothing hot was consumed. Constant. Distressing. And almost impossible to explain. If you've had unexplained cavities, tooth loss, or a burning mouth that nothing fixes, type teeth in the comments right now. Number 2. Swollen salivary glands. This is the symptom that can literally change the shape of your face. The parotid glands sit just in front of and below the ears on either side of the jaw. When they become inflamed in Sjogren's, the effect is a rounded, puffy appearance along the jaw and cheek that patients describe as looking permanently bloated, or what many call chipmunk cheeks. People ask if you've gained weight. They comment that your face looks different. And you have no answer because nobody has told you this is connected to anything. The swelling can be tender or painful to touch. It comes and goes for some people, which makes it harder to demonstrate to a doctor. By the time the appointment arrives, it has subsided, and there is nothing to show. People feel like they are not being believed. They wonder if they imagined it. It is also worth knowing that in Sjogren's, salivary gland swelling should always be properly evaluated, because while it is most often inflammatory, people with Sjogren's do have a modestly elevated risk of lymphoma, and persistent or asymmetric swelling deserves medical attention. If your jaw or cheeks have swollen up without explanation, type swollen in the comments. Number 3. Dry nasal passages, nosebleeds, and snoring. When people think of Sjogren's, they think of dry eyes and dry mouth. What they almost never think about is what is happening inside the nose, and at night, while they are asleep. The nasal passages are lined with a delicate mucous membrane that filters, warms, and humidifies the air you breathe. In Sjogren's, that membrane dries out. The result is a raw, cracking dryness inside the nose that causes thick, uncomfortable crusting, nosebleeds that appear without warning, sometimes on the pillow in the morning, and a soft whistling sound when breathing that is audible to others and quietly mortifying. At night, the dryness and inflammation in the throat cause tissues to vibrate or partially collapse during sleep, producing heavy snoring and in more serious cases obstructive sleep apnea, where breathing actually stops and restarts repeatedly through the night. Sleep apnea is not just about snoring. It is linked to high blood pressure, heart disease, and stroke. And for people with Sjogren's who are already battling crushing fatigue, undiagnosed sleep apnea makes everything catastrophically worse. Partners are often the first to notice. If someone has commented on your breathing during sleep, or if you wake up exhausted regardless of how long you slept, this needs to be investigated. Type nose if nasal dryness affects you, or snore if sleep is the issue. Drop it in the comments now. Number 4. Choking and loud, difficult swallowing. This is one of the most socially isolating symptoms on this list, and one of the most underreported. Swallowing works smoothly because every surface from the back of the mouth to the esophagus is coated in moisture. In Sjogren's, that moisture is dramatically reduced, and swallowing becomes conscious, effortful, and sometimes frightening. Dry food like bread, crackers, and meat becomes difficult. People automatically reach for water with every bite. They choose softer foods. They eat more slowly and more carefully. Then comes the choking. Food gets stuck. A coughing fit erupts at the dinner table, red-faced, eyes watering, apologizing to the people around them while genuinely struggling to clear their airway. Some people stop going to restaurants because the fear of choking publicly feels worse than declining the invitation. And then there is the sound. When the throat is dry and swallowing requires more muscular effort, it produces a noise, a gulp, an audible effortful sound that carries in a quiet room or a meeting. People become acutely aware of it. They try to time their swallowing to moments when ambient noise covers it. Something as basic as having a snack at a desk becomes a source of anxiety. This symptom is frequently dismissed as anxiety or reflux. The Sjogren's connection is almost never made. But it has a real, documented, physiological cause. If swallowing has become something you actively dread, type swallow in the comments. Number 5. Severe bloating, gas, and digestive problems. This is the area patients are most reluctant to discuss, with their doctors, with their families, and often even with themselves. Because bloating and gas and unpredictable bowel habits feel shameful in a way that dry eyes do not. Here is what is actually happening. Sjogren's affects digestion through several overlapping mechanisms. Reduced saliva means food arrives in the stomach already partially unprocessed. Reduced stomach acid, which Sjogren's can also cause, means food sits longer than it should and begins to ferment. The byproducts of that fermentation are gases that accumulate and cause the abdomen to distend visibly and painfully, sometimes appearing within 30 minutes of eating. People describe looking 6 months pregnant after a normal meal. Then there is the bowel itself. Sjogren's involves the autonomic nervous system, the system controlling gut motility. When those nerve signals are disrupted, the rhythmic contractions that move food through the intestines break down. The result is a brutal alternation between diarrhea and constipation. The diarrhea is sudden and urgent, minutes, not much more. People scope out bathrooms before committing to a table at a restaurant. They sit on the aisle. They quietly reorganize their social lives around bathroom access. Most of these patients are told they have IBS. Some genuinely do. But for a significant number, Sjogren's is the underlying driver that was never identified, and managing a symptom without addressing the cause is like mopping the floor while the tap is still running. Type GUT in the comments if your digestive system has been causing you ongoing distress. Number 6. Urinary urgency and incontinence. Now we are firmly in the territory that people do not want to talk about. And that silence is costing people years. Bladder problems in Sjogren's arise from 2 causes. First, the immune system can directly inflame the bladder lining, making it hypersensitive, signaling urgency far earlier than normal, at much lower volumes. Second, Autonomic nerve disruption scrambles the signals controlling bladder filling and emptying. The result is a sudden, overwhelming urge to urinate that must be acted on immediately, or there will be an accident. And sometimes there is an accident anyway, despite the planning. Despite the mental calculations running constantly in the background. A small one perhaps, barely registering. Or perhaps not small. And the shame of that moment, being an adult who did not make it to the bathroom, is something very hard to speak about to anyone, let alone a doctor in a 10-minute appointment. People stop drinking water to reduce frequency. They become dehydrated. They stop exercising because physical activity makes it worse. They stop traveling. They decline invitations. Quietly, one by one, their world contracts around this one invisible, unspoken problem. Please hear this clearly, this is not your fault. It is not a hygiene issue or a consequence of getting older. It is a documented feature of a systemic autoimmune disease, and there are treatments that can help. But only if you say it out loud. Type bladder in the comments. Say it here first, so you can practice saying it somewhere. Number 7. Vaginal and genital dryness. This is the symptom we most need to talk about. And the one most consistently buried in silence. Sjogren's attacks every moisture-producing gland in the body, and that includes the tissues of the vagina and vulva. The result is constant dryness, persistent itching and irritation that does not resolve, and a raw, inflamed discomfort that becomes a background reality of daily life. The skin of the vulva becomes thin and fragile. Sitting for long periods is uncomfortable. Certain clothing is impossible. Ordinary daily activities become sources of low-level physical misery. And then there is the pain during intimacy. Research has shown that pain during sex can actually be one of the earliest symptoms of Sjogren's in some women, appearing before dry eyes, before dry mouth, before anything else. A 2015 study found that nearly 80% of women with Sjogren's reported pain during intercourse. That is the majority of people with this disease experiencing something that affects their most intimate relationships, and not being able to connect it to anything medical. What happens instead is this. A woman goes to her gynecologist with vaginal irritation. She is tested for yeast infection. The result is negative, or the treatment doesn't work. She comes back. Another theory. Another treatment. Years pass. The misdiagnoses stack up. Relationships are strained by pain and avoidance that she cannot fully explain. Her sense of herself changes in a deeply personal way. And through all of it, nobody connects the dots to Sjogren's. If you have been experiencing vaginal dryness, persistent irritation, or pain during intimacy alongside other symptoms on this list, write it down and hand the paper to your doctor if you cannot say it out loud. Whatever it takes. This is treatable. The disease causing it is identifiable. You deserve not to spend another decade suffering in silence. Type dryness in the comments. You are not alone, and this matters. Number 8. Brain fog and memory slips. Now let's talk about what is happening above the neck, and why this symptom is, in many ways, the cruelest one on this list. Brain fog is not a medical term, but it describes something very real and very specific. It is a state of cognitive interference that sits between your thoughts and your ability to express or act on them. Thinking feels effortful in a way that is genuinely hard to explain to someone who has not experienced it. Here is what it looks like in daily life. You reach for a word, a common word, a word you have used 10,000 times, and it is simply not there. You stand at the edge of it. You feel the shape of it. But it will not come. You say the thing, you know, the thing you used to, and watch the other person fill it in for you, and you laugh it off, and you feel quietly horrified. This happens multiple times a day. You walk into a room with a clear purpose and arrive with no memory of why. You reread the same paragraph 4 times and absorb nothing. You lose the thread of meetings. You forget appointments. In professional settings this is devastating. People who were sharp and articulate find themselves stumbling, over-preparing for everything to compensate, feeling exhausted by the extra effort that every ordinary task now requires. When they bring this up, they are asked about sleep and stress and depression. All reasonable questions. But the framing places the problem in their psychology rather than their physiology, and they spend years in therapy while the autoimmune disease affecting their nervous system goes unaddressed. According to the Sjogren's Foundation's own patient survey of over 6,000 people, 77% reported brain fog as a significant symptom. That is not a niche complaint. That is most people with this disease. If brain fog is affecting your work, your relationships, or your sense of who you are, type fog in the comments. Number 9. Raynaud's phenomenon. This last one is different from everything else on this list. Not embarrassing in quite the same way, but alarming the first time it happens, and very often unconnected in people's minds to everything else they are experiencing. Cold temperatures or emotional stress cause small blood vessels near the skin surface, primarily in the fingers and toes, to spasm dramatically, cutting off circulation. The fingers first go stark white. Not pale, a blanched, waxy, defined white with a sharp border between affected and unaffected tissue, accompanied by numbness and a cold, dead feeling. Then as the spasm eases, they shift to a dusky blue as oxygen-depleted blood sits in the vessels. Then finally, as circulation returns in a rush, they turn a vivid, throbbing red that burns and aches. The whole sequence can last minutes or much longer. It can be triggered by reaching into a freezer, walking past an air conditioning unit, or simply picking up a cold drink. Over time people normalize it, carrying gloves everywhere, avoiding the frozen food aisle, warning people before a handshake. It gets folded into ordinary life and stops being mentioned to anyone. What most people do not know is that Raynaud's is a recognized associated feature of several autoimmune conditions including Sjogren's. It can appear before the more classic symptoms. It is a puzzle piece, and it belongs on the table when a doctor is trying to assemble the full picture. If your fingers or toes change color in the cold, white, then blue, then red, type fingers in the comments. So here is the big question. With symptoms this scattered, teeth, bladder, brain, fingers, digestion, intimacy, sleep, how does anyone put this together and actually reach a diagnosis? This is where the puzzle analogy matters. Imagine you have a box of puzzle pieces with no picture on the lid. A swollen jaw that came and went. A nosebleed that woke you at 3 in the morning. A tooth your dentist couldn't explain. A bathroom accident you'd rather forget. Pain during intimacy you have never accurately described to anyone. A word that vanished mid-sentence. Fingers that went white at a football game. A stomach that ballooned after a meal that seemed perfectly ordinary. On their own, none of those pieces looks like a disease. They look like bad luck. They look like getting older. They look like stress or hormones or the accumulation of ordinary inconveniences. So you carry each one separately. You mention some to some doctors. You leave out the embarrassing ones. And the picture never gets assembled, because you have never spread all the pieces out in one place at the same time. That is what needs to change. Sjogren's is a systemic disease with effects across almost every organ system. No single symptom confirms it. No single test catches every case. What confirms it is the pattern. The combination. The full picture that only emerges when someone finally tells the whole story. The high-risk groups are women, particularly those between 40 and 60, though Sjogren's can affect anyone at any age. People with a family history of autoimmune conditions. People who already have one, thyroid disease, lupus, rheumatoid arthritis. Diagnosis typically involves blood tests looking for anti-Rho and anti-La antibodies, eye tests measuring tear production, and in some cases a minor salivary gland biopsy. These tests are not perfect. Anti-Rho and anti-La can come back negative even when the disease is present. A negative blood test is not a clean bill of health. It is one data point among many. The weak link is not the tests. It is the silence. It is 9 to 11 years slipping by because someone was too embarrassed to mention the bladder leaks, or the pain during intimacy, or the choking at dinner, or the fingers that went white in the cold. That silence has real consequences. Undiagnosed Sjogren's means untreated Sjogren's, and the longer it runs without a name, the more damage accumulates. So here is what we are asking you to do. Scroll back through this video. Count how many words you typed in the comments. If it is more than 2 or 3, write everything down. Every embarrassing thing. Every symptom you have minimized or explained away or been too ashamed to say out loud. Bring that list to your next appointment. Hand it over. You do not need to say a word if that feels like too much. Just let the paper do it. Your doctor needs the real picture, not the edited, presentable version. Because the real one is the only version that leads anywhere. There is no cure for Sjogren's yet. But there is treatment. There is management. There are things that can make the dryness, the pain, the bladder urgency, the fog, the fatigue significantly more livable, but only once the disease has a name. And it only gets a name when the full story gets told. New diagnostic tools showing real promise for earlier, more accurate detection of Sjogren's are on the horizon. We will link to a video on that right here. And if this video helped you today, share it. Put it in front of someone who needs to see it. Because somewhere out there someone is sitting in a dentist chair getting another extraction, or standing in a bathroom at a party, or lying awake trying to find a word that disappeared, and they have no idea that all of it is connected. Help us reach them.